Good evening to all of you. Welcome to this press conference, and we thank all of you for finding time to join us. As you know, I spent from Monday to today morning time to Rwanda, where I was with the minister and the whole ministry senior staff, and also with colleagues providing support to respond to the Marburg outbreaks and also Mpox. I also took time to have opportunity to discuss with His Excellency President Kagame and to congratulate Rwanda for the excellent work they are doing to respond to the two outbreaks. I will provide more information when we'll talk about Marburg as supported by the Minister Sabine, the Minister of Health of Rwanda. Let us first start with an update on the Mpox, then we will move to Marburg. Can we please, okay, and second slide. Yes, we are saying that Mpox is still a major public health issue in Africa, with increasing the increase of number of cases. You will see in week 39, we had 3,186 new cases. And this trend is what we are seeing for the past 4 or 5 weeks, having between 2,500 to 3,000 new cases. And you also see that we have 489 new confirmed cases, because there is a difference between the suspected cases and the confirmed cases, mostly due to what we already know, the low testing rate and the low positivity rate. And you will see what Africa CDC is doing to support countries to address this issue. We lost 53 people. We don't see a decrease in terms of deaths, but we see an increase if we compare with previous weeks. It means the outbreak is still there, still increasing, and we need to continue to be focused to stop that. Unfortunately, Congo-Brazza, that didn't confirm cases for 6 weeks, that week confirmed a new Mpox case. And we are working with the country to see how we can accelerate a number of activities, including vaccination there. Next slide. This one, we are comparing every week number of confirmed cases to see if there is a decrease, because number of questions that we are getting, how can we say that we are having a normal situation on Mpox? If we have an increase of 300% in terms of confirmed cases, if you compare week 39, 2023 to week 39, 2024, we can all agree that Mpox is still a major issue in Africa. Last week, I think we shared with you that Ghana confirmed for the first time in 2024 a case that brings the total countries to 16. And we also know that we have what we call the top 5 countries for Mpox in Africa, that are still DRC, Burundi, Nigeria, Cote d'Ivoire, and Uganda in terms of cases. Next slide, please. We wanted to discuss with you, and this is the slide we start to discuss every week, because there is this young people who are affected, and we wanted to share with you the proportion of young people affected per country, not based on suspected cases, but based on confirmed cases. Because if we put suspected cases, it will be a different figure, but we started with the confirmed cases. You will see in country like DRC, confirmed cases for under 15 years is almost around 47%. And that is the same trend, a little bit more in Burundi, but you will see for countries like CAR, Burundi, DRC, it's almost the same trend. For other countries like Kenya and Uganda, even if affected by 1B, but young people represent around 15%. The key message is we have countries, mostly all of them with clade 1B, having young people affected. And we need to see how to continue to understand the epidemiology of this Mpox, especially clade 1A and 1B, in a number of countries, in what we call the Great Lake region. Because in DRC, you will see that more than 62% of total deaths are young people less than 15 years old. While in other countries like Burundi and CAR, we don't have children, we don't have deaths. It means we cannot say that children are dying from this virus. We are doing these studies to understand that epidemiology and to understand what are the underlying causes of mortality in DRC. Next slide. We wanted to share with you, especially in DRC, a kind of situation analysis in terms of provinces that are reporting cases, because that one is also helping us to have a kind of priority where the country is starting the vaccination. You'll see the top 3 provinces in DRC are South Kivu, Sankuru, North Kivu. It means the eastern part of DRC and the central part of DRC, because Sankuru is what we call the Kasai area. It means the central part of DRC. And if you go to the next slide, please. The next slide is giving us the situation in Burundi, just for us to also have the same analysis that we are doing. Next slide. In terms of lab performance, we're talking about low performance in terms of testing, in terms of positivity rate. You'll see it's mostly driven by Congo, the 2 Congo, and Liberia. And the performance in Congo is affecting the performance in all other countries. We supported most of these countries, Burundi, CAR, and others, with the lab equipment. As we shared with you, Africa CDC managed to provide the genomic sequencing to some countries, and also the qPCR. That is helping now these countries to be so performant and to test. In DRC, we have this decentralized approach that will help us to fill the gap. And we will this week and next week work more on Liberia and Congo-Brazza to fill the gap. Next slide. We wanted to talk a little bit about the vaccination campaign that started on the 5th of October in DRC. It started in North Kivu and South Kivu, following what I shared with you in terms of the priority regions reporting cases. And next slide. And you'll see, I think my colleagues, they will report to you that—
I have connected with but they have not.
Yeah, my colleagues will share with you during the discussions that there is clearly a success in terms of this vaccination, because we see population being mobilized and involved in 4 provinces where the campaign started. And we are working mostly in North Kivu, South Kivu, Chopo, and also will extend to other regions that are Sankuru, Kinshasa, very soon, and Equateur. And to date, I think what we got is giving us more confidence that the vaccination campaign will be a success. And we are congratulating the government in DRC for the effort they are doing to make sure that population are sensitized, and also health trainers and community trainers, community workers are trained to facilitate this vaccination campaign. We know there are some challenges, and these challenges are mostly from logistics side, and this is what is explaining the phase approach in terms of vaccination in DRC. I will stop there, and Meg, can you please check if the minister is connected? Then we can shift to Marburg before. Yes, the minister is there. Okay, Minister, welcome. Then let me hand over to the Minister of Health of Rwanda to brief us about Marburg. As I said in my introduction, we are congratulating Rwanda because what I saw in Rwanda is amazing. I didn't see in many African countries this kind of organization in terms of responding to the outbreak. But Minister, you are the leader there, you are the champion. We want you to share with the world what you are doing to stop Marburg in Africa. Over to you.
Thank you very much, DG. Good afternoon, good morning, everyone, wherever you are connected from. First of all, I'd like to thank Director General of Africa CDC, who has been in Rwanda, has spent 3 days with us, and also the team of Africa CDC on ground since the very first 48 hours of declaration of the Marburg outbreak in Rwanda. Africa CDC came in very fast, and other partners, of course, but I would like to begin by this message of appreciation to you, DG, and colleagues at your team. So we met last time. We gave you the updates on where we are today, but I want to give you the latest updates that since the outbreak was declared in Rwanda on 27th of September, we immediately put together all the efforts to respond and to stop this outbreak before it spreads to other places. So I would say that we're making progress. Of course, there are positive cases that were identified, treated, and there are contacts as well. So as of today, we've had up to 58 confirmed cases of Marburg virus disease. Unfortunately, we lost 13 people, and we had also 12 people who recovered from this disease, which is good news. So we estimate a calculated case fatality rate of about 22%, and we want to keep this as low as possible. But at the same time, also stopping the new transmissions. That's why intensifying testing is a key strategy. With contact tracing, but also ensuring that the community, the population is aware. We've conducted more than 2,700 tests. We're close to 3,000 tests. These are generally everyone presenting symptoms suggestive to Marburg, but these also include contacts of cases that were tested at different times. We've also used different therapeutics, and we also appreciate the partners who have helped, who has contributed to these efforts, including the antivirus we received in partnership with Africa CDC, with Gilead. We've had monoclonal antibodies with our colleagues and partners in the United States. We've also started to vaccinate most at-risk groups. So far, we have reached more than 100 vaccinations. Already provided to particularly those in affected. This is a ring vaccination contacts of confirmed cases. So I would say that the efforts and the partnership on the ground is promising. We also put a lot of efforts on the points of entries, particularly at Kigali International Airport, at land borders, as we ensure that no exported infection or risks to other countries, both in the region or also far from Rwanda, because it's our international health regulation responsibility that we protect our communities, our population here, but also the populations of the world. And this depends on how we respond to this virus. The government of Rwanda has put in place screening mechanisms. We have listed all contacts, and they have put in electronic systems that ensure close contact was supposed in isolations, in quarantine, do not move or travel to avoid any export or transmission that may go unnoticed. So that is to reassure our colleagues and partners that what we most of you who have been in Rwanda, including the Director General, we've been visiting these such sites, as well as the Kigali International Airports, where all these efforts are put in place. So we are working closely with partners across the world who have offered support in different ways, and we want to also appreciate them for this solidarity that although this is the most dangerous virus in the world we are dealing with, but we have worked and we came up stronger to respond to this one and to other similar outbreaks that may happen here or elsewhere in the world. And the faster we stop it, the better for everyone. So I'm happy to join this conversation again and look forward to your comments and questions on this conversation until 4 p.m. March.
Okay, thank you so much, Minister. We want to thank Rwanda. Let me add what I saw in Rwanda. It's almost zero risk. I say almost because we cannot say 100% sure, but I can say at 95% sure there is zero risk for Rwanda to spread the disease out of Rwanda. What I saw, the mechanism they put in place, even the call center that they have, bringing all services together, army, police, ambulance, hospitals, everyone, even the traffic control, the road traffic control, everyone is sitting in one room. And when they have a call, they can locate an ambulance anywhere in the country, not in Kigali, in the country. And they can deploy personnel on timely mode. And the mechanism they put in place, even to follow the contact, no contact can fly out of Rwanda. And this is amazing because they are monitoring this contact on daily basis. And I want also to say, Rwanda is applying transparency for this outbreak. And when a country is applying transparency, the country cannot be punished. We believe that all of our partners, all of our Western countries, and you saw the statement from Africa CDC, supported also by WHO, to say the travel ban cannot be applied, especially for a country doing more than what the world is doing to control outbreaks. And I have also to say that the outbreak in Rwanda is controlled. Yesterday, I was amazed to receive the report for the day there was 0 new case, 0 death. It means we are expecting to see Rwanda out of this outbreak very soon. But I will stop there by saying the way they are managing this outbreak, the case fatality rate is 22%. Let me remind you that in 2023, for the outbreaks that we had, the case fatality was more than 65%. If we go to 2022, the case fatality was more than 80%. And you can compare that and you can say loudly that Rwanda is putting in place everything, all mechanisms. And maybe the minister shared that with you. The vaccination against Marburg started. It means the post-exposure prophylaxis started. Rwanda got all drugs to support people who need them. And also the way they are deploying the testing across the country, supported by Africa CDC and other partners, it's just amazing. I think let us discuss about the success, because for me, this Marburg was an opportunity to discuss how Africa can start to lead the agenda of outbreak response, even pandemic response, by taking an example of what Rwanda is doing. With that, Margaret, over to you for questions from our colleagues, journalists.
Thank you, DG. Let's take a few questions from the floor. I'll first go for Helen Branswell from Stats. You have the floor. Helen, can you hear us? Helen, can you hear us? Let's move on to the next person. Sarah Javing from DVEX, you have the floor. All right, I think we might have a problem with the. Can you hear us? All right, let me just take a few from the chat box for now. One question goes to the Honorable Minister. The question asks about the type of vaccine that is being used in Rwanda at the moment. If you could explain about that. And then the next question goes to DG, asking about how Africa CDC is managing cross-border interaction following the Marburg outbreak. Let's take those two and then we'll move on to other questions. Over to you, Honorable Minister.
Thank you, Margaret. The vaccine we are using is known as Marburg vaccine CAD3, the vaccine from Sabin Vaccine Institute. So it's a partnership with, of course, the institute, but also other partners who have worked around this vaccine. It's phase 2 investigational vaccine that has been used before and promising. So yeah, that's what I can say about the vaccine. So, I'm not an expert in vaccinology, but if we need more details, we'll be happy to provide later. Thank you.
Yeah, thank you, Minister. Before maybe answering my question, I think my colleagues, they unmute journalists because I saw some of them, they are sending in the chat group that they are muted. How are we managing the cross-border activities? I think what we are doing as Africa CDC, first we started to put in place the incident management team, the Continental incident management team comprised by all partners and talking with each country and to strengthen the capacity of the country to collect information. This is the first one. And to share this information using the bilateral mode or using IMST to ensure that all countries are informed about what's happening. The example is the Marburg in Rwanda. Once we got information, we are using the IMST opportunity to share this information across all countries in the region. And we are also working to strengthen the surveillance capacity and diagnostic capacity. For Marburg, we managed to order more than 5,000 test kits, and we are also continuing to order this kit for Rwanda, but also for other countries that are neighboring countries, for us to ensure that when there is a case, if there is a case, they have ability to detect quickly and then to do the genomic sequencing for us to know where it came from. We are also working with Japan for the rapid test that will be deployed at the borders of each country for quick testing, mostly for people who are crossing the border and they have some symptoms. Yesterday, Rwandan authorities were informing me about a number of people sometimes crossing the border, and we need to ensure that there is no spread in addition to all measures that Rwanda is taking. All measures we are talking about Marburg, we are also supporting Mpox, and that system will remain in place even after when the Mpox and Marburg will be over. We want to continue to maintain a strong cross-border surveillance to ensure that no country can export a disease in another one. If that can happen, we need to detect it that quickly and to stop it. Over to you, Margaret.
Thank you, DG. Let's take the next two questions from the floor. Sarah Javing from DVEX, you have the floor. Sarah, can you hear us?
Hi, can you hear me?
Yes, we can hear you.
Okay, great. Thank you so much. My question is for the minister. I know that the NCD Alliance decided to postpone their conference that was to be held in Kigali. Have there been many conferences that have decided to postpone, and was this a government decision? And how is the government making those decisions around kind of balancing the health situation, the outbreak, and then the economic health of the country? And then I believe Dr. Kaseya said that the fatality rate was 22%. Can you elaborate on why you think it is kind of relatively low? Because from what I understand, Marburg fatality can reach 88%. Thank you.
Thank you, Sarah. All right, thank you, Margaret. I was trying to save time, so appreciate it. Yeah. So, yes, NCD Alliance announced the postponement of the conference. It was not a government of Rwanda decision, and other events are taking place. Even as we speak, there are conferences happening. Dr. Kaseya, the Director General, Africa CDC, were together yesterday in a big conference called Biashara, Business in Africa, and many other conferences are still taking place. So I would say that the outbreak is under control and people are arriving in Rwanda for conferences. The measures taken to ensure that everyone is safe, and those who have contracted this virus, the cluster that is mainly in the 2 hospitals that we are controlling, are all isolated, their contacts, and we don't see any risk to avoid travels or conferences. So I would like to emphasize on this, that we are dealing with this outbreak, but the control and measures in place can reassure travelers and also conferences organizers like the ones that are taking place as we speak. For the case fatality rate of 22%, I think, as we said before, there are several therapeutics that have been applied in our treatment options. Generally, this virus is all about the earlier you detect, the better the outcome of treatment. The more therapeutic or supportive treatment you provide to the patient are also critical. And we've put a lot of efforts in the treatment center to make sure that the patients receive all this supportive treatment, the antivirals, post-exposure that is given very quickly has also shown some good results, and also monoclonal antibodies for those we treated have also contributed, although in small quantity. Not all received it. And now with vaccines, we believe even the case fatality rate will be much better than what we had before we get these other tools. So this is what we see so far, but it's still too early to conclude. But our aim is to save as many lives and as quick as possible, and also stop the spread. Because when it gets too far into the community, that's the worst case scenario we don't see now. And that's why the efforts needed are required, and the time and speed matters a lot. I thank you.
Thank you, Honorable Minister. Let's get the next question from Helen from START. You have the floor.
Thank you very much. And thank you for those presentations. My questions are for the minister, and they are about the use of the vaccine. Can you, when you were speaking earlier about how many doses had been administered, the sound sort of faded out and I couldn't hear what you said. So if you could go over that a bit, please. Also, can you tell us about the clinical trial? What is the protocol? I take it there's no placebo, and I don't think you're using delayed ring at this point. So what kind of a clinical trial is it? And lastly, I think so far you've received or will soon receive 1,700 doses from the Sabin Institute. Do you think you're going to need more? And if so, is there more available to you? Thank you very much.
Great. Thank you very much, Helen. So you're right. The vaccine is an important tool, and this investigational Marburg vaccine from Sabin Vaccine Institute was one of the solutions we see is going to be helpful. So we've already vaccinated more than 200 people as we speak. There are others being vaccinated. So we had initially received 700 doses for most at-risk groups. We expect this to be protecting those in treatment centers I mentioned, but also in departments in these hospitals that have been most affected for healthcare workers, but also the contacts of confirmed positive cases, which is known as ring vaccination. So in terms of protocol, we used the first approach protocol, which means there's no delayed arm so far, but we are planning to also, as we expand this vaccination, of course, for us, saving lives matters. Delaying has also its challenges and consequences. So it's an open labor study. Of course, I'm not the principal investigator to give more details, but at least we know that this is the approach to vaccinate people quickly through an approved protocol, and that the delayed arm protocol that we are working on with World Health Organization is also going to be considered in the next phase. So we expect some more doses soon. We may also get more in the coming future. So that is what I can say for now. I thank you.
Thank you, Honorable Minister. Let's get the next question from, let's see, Makochi of the BBC. You have the floor. Makochi, can you hear us? All right, let's take the next question. Carmen from Politico, you have the floor.
Hello, can you hear me?
Thank you so much, Margaret. So I have a question for the Minister of Rwanda. I was wondering, sorry, just one second. I was wondering if you had any reaction, and you alluded to this, but I was wondering if you had any reaction to the measures that are being put in place here in the US to direct travelers who have been in Rwanda in the last 21 days to 3 airports where they will be screened. So it's not a ban per se, but it's a screening of passengers from Rwanda. And I was wondering whether you have a reaction to that. And I have also a question for DG Kasea. Do you have any numbers of how many people have been vaccinated against Mpox so far in the DRC? Thank you.
Thank you, Carmen. So in terms of travel restrictions or levels that were announced by the United States, I think our stand is that let's be guided by facts and science and evidence. And this is what has been also our stand from the beginning when we detect this virus. So we're ensuring that there is no risk to anyone from our country, as we wish also there should be no risk from any other places to our country. We know that this is a global issue, and we don't see any reason why restrictions should be come without evidence and facts. So we are working with different people, with different partners, including colleagues from the United States. And our priority for now is to stop this outbreak as quick as possible, because it affects us and others. But restrictions or travel bans sometimes not the best thing to do in these situations if we can contain rapidly. And I would say that everything you're doing should be guided by facts and science. We don't see this happening all the time, and for people on frontline, it's not encouraging. So that's what I can say for now. But I think Africa CDC has been clear. It's not just for Rwanda, it's for any other country, that whenever there is a problem, an outbreak, declaring it or reporting it should be encouraged because it is helpful to everyone. So the feeling that being transparent will be a reason of banned or travels should not be a good way to respond to outbreaks. So that is what I can reflect on and say. It's not just for one country. It should be a message to all of us, to other countries. So that is what our stand. In our position, we are not going to change what we are doing, which is fact, science, evidence-based, and save our communities and our partners or neighbors from near or from far from this virus. And we don't think going into confining a place or a country or a continent is going to help anyone. The thing is, how do we extinguish this fire before it burns everyone? So the fire may come from your neighbor, and if you want to extinguish the fire, it's better for now and for tomorrow. But the world is so interconnected. So these are my comments on that. Thank you.
Yes, I will support the Honorable Minister because yesterday I made public comment during the conference Biashara in Rwanda. I said that the decision taken by the US government was not fair, and we believe this is not the treatment that Rwanda and Africa deserve. Why we are saying that, especially for this level 3 status decided by the US government, Rwanda collaborated with all partners, including the US, to show that there is no risk of spreading this disease. Myself, I was in Rwanda. I went through the system. Even at the airport, I was screened. I have my QR code in my phone. And I can confirm that when you don't have this risk to spread the disease, you cannot be categorized as high risk to spread the disease. Our focus now, because this L3 status is affecting not only the morale of people, because we need to talk about it. While the government is doing everything possible, even more than what is possible, by deciding this L3 status, we are creating a panic mode, unnecessary panic mode in Rwanda, in other regions, in other countries in the region, but also in the world. While this is not evidence-based, as the minister is saying, I had the opportunity to discuss that with senior officials of the US government. And I told them, next time, if there must be this kind of decision, they're first to call Africa CDC to discuss with us and to show the evidence why they have to make such decision. And they have second to call the country if it's one country. Because this decision was made without further consultation with Africa CDC, nor with Rwanda. And we think this is so disrespectful for us. And I gave this clear message to the US senior officials, but more important, we agreed on the way to move forward. I think I got their clear commitment that in the future, they will not do that again without consulting us. Second, we agreed to work together to continue because the US CDC is providing huge support to Rwanda. Let's recognize that. We have a number of people I saw there. We have tools they are sending. It means what the ministry is doing, what the government is doing with our support, Rwanda can be out of this outbreak very quickly. I think this is the major focus for us. Let us work on that and to see if we can lift this L3 status by the end of October. About people who are vaccinated so far, Professor Nikes can give you. Nikes, can you please give the information about people who are already vaccinated against Mpox? Nikes, are you connected? Okay.
Yes, we are. I will provide.
Okay, go ahead, please.
Yes, I'll provide a response to the request related to the numbers of vaccinated individuals in the DRC. In terms of the breakdown in terms of provinces, in North Kivu, we have 1,247 individuals vaccinated. In South Kivu, we have 269 individuals vaccinated. In Chopo province, we have 138 individuals vaccinated for a total of 1,654 individuals vaccinated currently in the DRC following the first phase of vaccination. Thank you.
Back to you,
Thank you very
Margaret.
much. Thank you. Let's take the next two questions from Makochi from the BBC. You have the floor.
Hello, can you hear me now?
Yeah, we
Yes.
can hear you.
Oh, brilliant. Oh, sorry, the question has been answered. It was actually in response to US CDC's action too. Thanks, sorry. I'll take my hands down.
Thank you very much. Let's take the next one from Kai. You have the floor.
Sorry, can you hear me?
Yes, we can hear you.
Perfect. Thanks so much for taking the question. So for the minister, I just wanted to ask, if I understand it correctly, you're saying for the moment, both the vaccine and the treatments are given open label. And as I understand it in the past, I mean, kind of protocols were developed and Rwanda had one on the books as well, right? For exactly this kind of situation. And I'm just curious kind of what the thinking was in deciding to go for an open label trial. Can you explain a little bit what the trade-offs were and what kind of made you go with that instead of using the trials that were discussed before?
Thank you, Kai. I think the approach we are taking now is to save people's lives. And this is about speed and caution. So the protocol you're referring to were developed 6 months ago. And this including the delayed rather than rapid response open label, which is the protocol we are using. So in consultation, in partnership with our colleagues at World Health Organization, we came to this conclusion that we are going to use this rapid label approach for now and move on to the initial protocol after we have at least protected the most at risk. So all these protocols were reviewed by secured necessary approvals, both the regulatory and also ethics approvals, which are required and convenient. Thank you.
Thank you very much. Let's take the next question. Oscar from Spanish media, you have the floor. Oscar, can you hear us? All right, let's take the next one from Gabriel Emmanuel from NPR. You have the floor.
Hi, thank you very much. I just was wondering if you could clarify the timeline of when Rwandan officials learned about that first Marburg test. I've heard that it was kind of very early in September, but although the public wasn't informed until I believe it was the 27th. So I just wanted to clarify when that first test was done, the first patient was identified, and also if there's any insight into how that first patient got exposed. Thank you very much.
Thank you, Gabriel. First of all, I would like to say that the information that this test was done before and not communicated is not true. The truth is that the tests were conducted on 26 September, confirmed the same night, and announced publicly on the 27th. Everything happened within 24 hours, and they followed international protocol and guidelines. So this is the fact and the truth that we've even done for previous outbreaks. So I'd like just to give you this as the fact. And tracing back where the first patient came from, where the virus came from, is an ongoing effort. And we very soon, in a few days, completing our sequence activity and also other testing, including ELISA, serology. So we are combining several efforts, including One Health teams working together on epidemiologists and vets. So we're soon going to, in a few days, come up with a conclusion. But at this moment, I cannot say that this is our patient zero, but we have some areas or some pieces of information that we are going to be sharing once we concluded this particular sequence approach, for which actually I want also to thank Africa CDC that has brought in a team to work with our National Reference Lab teams at Rwanda Biomedical Center. Thank you very much.
Thank you very much. Let's take the next one from Janice of Bloomberg. You have the floor.
Good afternoon. Thank you very much. I saw reports that the DRC has reported its first suspected case of Marburg virus disease. And I was just wondering if you had any more information about whether that person who's been quarantined has tested positive, and if there are any other cases regionally that the Africa CDC is aware of in countries that border on Rwanda. I believe that health officials in to the communities in DRC they've put those communities on high alert. Yeah, just trying to get a little bit more information about bordering areas.
Thank you very much. DG, do you want to take a question?
Yes, we are following that, but I want to give the lead to IMST team. Professor Nikeza and the team, can you please update us on this suspected case that was negative, but more information on that? Over to you, Professor Nikes.
Thank you so much, DG. I think this is a very good example that we have reinforced our surveillance system. So we are able to pick some of these cases within the community, at least the suspected cases for other diseases or clinical conditions. So I can confirm that the suspected case was tested, and then the result from the lab was negative. So we are still monitoring the situation very closely with the government officials on the ground. Thank you. Back to you, DG.
Thank you so much. Janice, just to provide more information on that, when we got this alert that came from Goma, we said we need to act very quickly and in a few hours to have confirmation and to know if it's positive or negative, if it's positive, where it came from, and what could be the necessary measures we could take. Even if we have to say, now we are almost ready for any worst case scenario in any other country. And we are learning also from the experience from DRC in the past, also this experience from Rwanda. And it's related also to the question that Ellen was asking about the cross-border surveillance. I think Africa CDC and all partners, we are reinforcing our capacities, our capacity of countries to detect early and to confirm if there is any Marburg, Ebola, Mpox, or any other outbreak that we can have in our region. I think for now we are fine. We are briefing, and we hope we can continue to brief for a very long time on that.
Thank you, DG. Let's take the next question from Oscar from the Spanish press. You have the floor. Oscar, if you can hear us. All right, let's take the next one.
Can you hear me? Can you hear me?
Yes, we can hear
Okay,
you. Yes.
Thank you very much. Good afternoon to the minister and to the DG. I wanted to share with you an understanding and to ask you whether if I'm right or wrong, no? Because if I understand properly now, the success story that is showcasing Rwanda, I believe that after following a bit how it started and all of this, no, I think that since it was declared in 27th September, that's when the hospitals knew about what they were dealing with. That's when they started to have control of the situation. No? But most of the cases and most of the infections among the health workers was done when they were thinking that maybe it was malaria, that were not taking the necessary precautions that are necessary to take in Marburg. But otherwise, that is not so difficult. If the things are done properly, as Rwanda has done, it's not so difficult to treat even a patient of Marburg. No, I think that when we have seen in Sierra Leone or in Niger that time, that panic that we were seeing at that time, that was the case. The reason behind the mortality rate. I think that everybody knows that if you are facing a patient of Marburg and he is sick, of course it becomes very dangerous, no? But if he's not sick, then he's not so dangerous. So I mean, having a conscience of where is the balance, no? What is the equilibrium? What you can do and what you cannot do. If you are aware of that, then it's easier to have control of the situation. And I just wanted to check with you to show that even the vaccines have not been decisive, no? Of course, it's very important to have them in case the situation goes out of control, and if it is spread in the community and so. But if in a situation where it is controlled, like with 200 vaccines, that has not been the reason even to get it under control. Because I wanted to share even the monoclonal treatment or therapeutics from Gilead where started to be done, started to be given some few days ago. No, I mean that the curve has started going down before the doses arrived even. That's what I wanted to share and make sure that I'm right. Sorry. That's it.
Thank you. Thank you, Oscar.
Oscar, I think I may say that you're right saying that the readiness of healthcare providers to treat Marburg patients with the right protection determines actually how the outcome will be. So the first thing when you have such a dangerous virus is to get people ready, protected, and to have people well trained to manage these critically ill patients. Sometimes the earlier the better. So on the vaccines, yes, it's just the first 3 days of vaccination. Our aim is to make sure we don't have new infections, and also those who are highly exposed are comfortable to treat. It's not an assurance that they may not be infected, but it's an additional protection layer for them, for their families, and also for their patients. So we are learning a lot through this outbreak. It's not just for us, it's for the entire world. That's why we've been very clear and transparent on everything we do, learning with you. This is an important scientific opportunity as well to improve and to be ready for next similar outbreak. Thank you. And I have to apologize because I have to join another meeting, already started 2 minutes ago. If there's one more question, I can take it. But DG, if you allow, I can move on to join my other colleagues. I think.
Yes, I think it's also almost the end of our time. But Margaret, if there is any other question to the minister, then we can conclude.
All right, let's take one more question from Paul. You have the floor. Paul, can you hear us? All right, let's move on to Morgan Morris. You have the floor.
Hi, good day. Hi, thank you, Minister, for joining us and for being available. I just have a quick question. I want to know if the antivirals donated by Gilead is the only therapeutic you're using currently, and if so, are you confident you have enough doses? I'm not sure how many doses you need per patient. Are you confident that you have enough doses? Because efficacy series said you received about 5,100 doses a few days ago. Are you confident those are sufficient, or do you expect an uptick in cases, perhaps? Yeah, thank you.
So thank you, Morgan. The antivirals we're using, particularly remdesivir, we've acquired 5,100 doses with Africa CDC and Gilead donation. We expect to continue. If these doses that we have, we need more, the conversation is continuing. But so far, we have enough doses for patients we have. I hope that we're not going to have many more cases, which is more important. There are other therapeutics we're using, but these are being used. I mentioned monoclonal antibodies. They are different supportive treatment, but sometimes we talk more, but there are also other treating, including supporting, including even those with kidney, for example, for very good dialysis patient in ICU so far, those in virus.
Yes, Margaret, I see the minister has also some network issue, but maybe it's also time for us to thank the minister for finding time in the middle of this crisis to talk with journalists. Hope we'll have more updates, Minister, next Thursday. And we can continue to share very good news, because I think the main message that came from the minister today is 12 people who recovered, because that one must be emphasized. And we don't just have to talk about deaths, but let us talk about people who recovered, and let us talk about all tools that the Rwandan government is putting in place to stop the spread and to have more people out of the hospital. Thank you, Minister, and we appreciate your time for being with us. Margaret, with your permission, I can maybe conclude today.
Yes, DG.
Yes, we are concluding because also we have a number of other meetings to support countries, but this press conference is so important for us. This 1 hour 20 we are dedicating every Thursday is opportunity of conversation for us to provide more information on what we have. As we say, the leadership of the country is essential to support, to combat these outbreaks. And we need also to bring the regional and the continental approach. And the cross-border surveillance is one of the aspects of this continental and regional response. We are open as Africa in innovation. This is why we are supporting even clinical trials. You saw what we are doing in a number of countries, including DRC, Rwanda, and others, to make sure that we have appropriate tools that can respond to the needs of our people. And saying that, we are talking about the intellectual property issue. And our call today, together with Dr. Tedros, the DG, WHO, and other partners, is to finalize the pandemic agreement. This pandemic agreement will facilitate the intellectual property issue and will also unlock the door for local manufacturing in Africa. We wanted to emphasize, and will say it strongly, travel ban is not a solution. It, even if not evidence-based, it's a fault. And it's undermining the trust that we have, and it's not helping on the support we are providing everywhere to stop with outbreaks. Then we are calling our partners not to use that travel ban policy when we have these outbreaks, and we are working together to respond to that. Because I have to repeat, when other continents were affected, Africa didn't implement the travel ban policy against them. Let us continue to work in solidarity. We are in one planet. We are the same human beings. Let us continue to be together. We congratulate Rwanda and DRC, and we will hope that Nigeria will start the vaccination campaign very soon, and also Congo, CAR, and other countries, because we want to stop very quickly with these Mpox and Marburg outbreaks. With that, we thank all of you. We hope to see you next week on Thursday. And if there are still questions, our colleague Margaret is available to receive and will respond to that. Thank you so much. Bye-bye.
Recording stopped.